Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, our guest today is Dr. Sharon Martin. Dr. Sharon Martin is a traditional allopathic doctor who has integrated energy healing into her personal practice. Dr. Sharon Martin is the author of Maximize Your Healing Power, Shamanic Healing Techniques to Overcome Health Challenges. And you can find out more about her and her wonderful work at her website, drsharonmartin.com. Welcome, Dr. Sharon Martin.
Thank you, Catherine. Thanks for inviting me.
So, Dr. Sharon Martin, your training as a medical doctor, you were trained at Johns Hopkins Medical School, which is ironically where my father, who's a medical doctor, went to medical school.
How about that?
Yes. And even though I'm a medical intuitive healer, I've got 5 doctors in my immediate family. My brother, my father, my grandfather, my great-grandfather, and my uncle are all medical doctors.
Wow.
And so even as a medical intuitive healer, I believe that there's something to benefit all of us. And that in natural healing, we can take the best of all systems of healing. So as a medical doctor, you have been trained in shamanic mystery traditions. Why did you, as a traditional medical doctor, start studying energy healing and shamanism?
Well, it's exactly as you said, putting all the things together, everything you can have, all the tools in your repertoire. Why would anybody not do that? So that's the big picture answer. The short answer is there is a lot to healing that isn't under mainstream medicine. Mainstream medicine does not always include the patient's spirituality. It doesn't always include their power over their own health. It doesn't include a lot of things. And I found myself yearning for a kind of healing that was more big picture. And with multiple events and encounters with my patients, and then I said, I need to go back to the basics. And shamanism is an indigenous, long-held way of healing. It's how the healers in the tribe actually saw you as a member of the tribe, as a part of the community. It's very much connected to spirit, and very much connected into the individual's power over themselves. So it was sort of an easy transition.
So as you are well aware, shamans frequently work with power animals. Now, for probably about 2 decades now, my power animal is snow leopard. So snow leopards are fantastic leapers, and they have beautiful tails. They're very rare. And one of the things they do is they empower people to make major leaps. And that's what I do in my work as a medical intuitive healer. Just out of curiosity, what is your power animal?
Well, it started out when I was training in shamanism as jaguar. And for me, that was for protection, but also in the Peruvian shamanic technique, the jaguar was the one who could, and actually in the Yucatan Peninsula, the jaguar is the one who could enter the underground at night and come out unscathed in the morning. So I liked that ability to go anywhere and not be afraid. My current power animals, and probably for 10 years now, are dragons. And they, to me, they are creative forces of the universe. And they are able to make things happen when 1 + 1 is 3. So that alchemy and that miraculous shift, that's how I communicate, work with my dragons these days.
I love that. And as you know, over the years, even though you can have a major power animal that accompanies you throughout your life for your sole purposes, you can also have power animals that come and go.
Mhm.
And I've worked with hummingbird. Hummingbirds
Uh-huh.
are for endless joy. And I've also worked with dragonfly, which is major transformation, and hawk, which about sees the big picture.
I love working with hawk. Mhm.
So why, in your professional opinion, is it important to incorporate the mystical and spiritual aspects for making a shift with our health?
What I've come to believe as I'm learning now, and I think mainstream science is starting to learn more about this, is that our reality is based on a connection to the universal field. That's where our consciousness interacts. And that's where the information is held as what I'll call the templates, the life force for all of our being. And even though we can get down the microscope about a certain body system, something's wrong with your chemistry, something's wrong here and there, the major connection to me is in consciousness and life force and connecting with that universal field. Well, mainstream medicine doesn't help you do that, but these mystical traditions do. And so the truth is, healing, a very huge, and if not the major part of healing, is your belief in the ability to be different. If you don't believe that you can heal something, it won't happen, in my opinion, in my experience. So bringing in those mystical traditions connects us to the universe, to the unseen world, to the powers that are bigger than our human selves. And that, to me, is critical if we want to become co-creators of our own destiny.
Beautiful answer, Dr. Sharon Martin. Now, in my work as a medical intuitive healer, I look at what I refer to as the 5 levels of healing. The physical body, which the allopathic medicine is really brilliant at, with all their lab tests and so on, they can tell you a lot about what's going on the physical level. And then there's the energy level, which is the province of Reiki masters and acupuncture healers. And the energy body includes your acupuncture system, the chakras, okay, which is the province of yoga teachers and qigong and tai chi masters, the acupuncture system, the chakra system, and also the breath, which we work on with pranayama and breath work. And then there's the emotional body. And in my view, emotions can shut down anything. And I agree with you on the mental body. That's our thoughts and beliefs. So as you say, if you think you can't, you can't.
Right.
And if you think you can, you can. And then finally, there's the soul level, which is the eternal part of you. And in my view, your soul controls your mind controls your emotions, and your emotions control your energy, and your energy body controls your physical. So as someone who integrates shamanism with traditional medicine, how do you actually work? How do you combine these 2 points of view, which are very different?
They are on face value very different. And the main thing, the simple answer to your question is, what has changed for me is my perspective towards a patient and my ability to see things at a different level, at a deeper level. What has actually changed in the literal encounters with them is being able to talk to a patient and say, I really sense your vitality and life force are down. Now, I may be sensing that with intuitive skills that I learned in shamanism, and they may not understand that at all in terms of shamanism, but they'll go, yeah, you're right. People get it when you talk to them about their energy field. They get it when you talk to them about you're working under some rules, what we might call a soul contract. It seems like you have rules that you're always the one to pick up the pieces. And they'll say, oh, yeah, I have to. I've done that since I was young. Then you start to explore, again, holding the shamanic view. You're working under a soul contract. Why don't we change that? Because you're burdened by it. But when you say, why don't we change that rule? Who said you have to follow that rule? You are challenging a belief as you would in shamanic healing. So the language I use may not come to the patient and say, listen, I'm going to use a feather to clear your field. I'm going to use a crystal to do this. But I do say things like, if you want this to change, sit in meditation, put a candle there, write it down, burn it up in the candle, and contemplate it going away. Those same beliefs and ritualistic practices can be explained to somebody, even if you don't tell them, well, this is what the shamans in the Andes have done for 10,000 years.
Beautiful. Now, I love that you talked about energy, because in my work as a medical intuitive healer, the first thing that I do when I'm doing a medical intuitive reading is I look at a person's overall chi level, which is your life energy. And I explain, if you have $1 million in the bank and you make a mistake, it's like, oh, well, wish that hadn't happened. But if you have $10 or $100 in the bank and you have no energy, it's very hard to heal. So one of the things that we can do when we want to heal is to actually increase our life energy. Your book is called Maximize Your Healing Power, Shamanic Healing Techniques to Overcome Health Challenges. What are some of these shamanic healing techniques that the average person can use to heal themselves naturally?
So I talk about several processes to get to know what your energy field feels like and how to clear it and how to rejuvenate it. But the easiest thing, and I'm very biased here because shamanism is animistic, and I'm strongly connected to nature, is get outdoors, because there are energies and vibratory fields that trees hold, that plants hold, that when you step into a relationship with the unseen world, you can join up or ally yourself with those elements and gain more chi and gain more power. And so you don't even have to do anything other than go sit on the grass. So even though I teach things that are a little bit more complex, my simple answer and my go-to answer for everybody is get outdoors, go sit under a tree, go walk past some flowers, go see the bee circling around the grasses. We as humans have always been deeply connected to the earth, and that connection is fading as we live in this high-tech world. If we restore that connection and work on it, we can gain a lot of energy.
Now, one of the things that physics tells us is that anytime you have a vertical electrical field, and if I'm standing up, I'm vertical, that there's a magnetic field perpendicular to that. So New Agey people and energy healers refer to that as our energy field, right? So that's that second level of healing, the energy body. How can the average person begin to sense our own energy field? What's happening with our energy field?
So I'll just share one of the exercises I teach in my book. And it's outside, standing on the ground, then facing each of the directions, and with attention and focus on what you're doing, bending down and thinking about scooping up energy from the earth and bringing it to the heart center, bringing in energy from the heavens to the heart center, doing that 3 times, turn to the next compass direction. You usually go clockwise in the traditional training. Do that at each of the directions. And then ask yourself, how do you feel? I'm going to guarantee that you feel better. And that you are actually, as Tai Chi would probably tell you, or Qigong would tell you, you are bringing energy. You are bringing in energy from the earth, from the heavens. And if you just feel how you change, you may not know your aura or your energy field, but when you do that, you know that you are enlivened.
As you were describing this shamanistic practice of standing in each of the directions and pulling in chi, I was going to say that sounds exactly like Tai Chi and Qigong, right? So gathering chi. So in your opinion, how can we break free of challenges, problems, or habits?
The biggest hurdle, I believe, is your willingness to change. That takes courage. That takes honesty. So I have a medicine wheel that I intuited that's in my book, that I show a 4-step, again, the cardinal directions, southwest, north, and east. I show the 4 steps of what I see as any process. And the first step is to be aware. And that takes honesty and that takes courage to actually admit to yourself that you're perhaps the one adding to your illness by the fact that you never exercise or you never eat decent food. The second step is the allow step. And that is when you get help from sources higher than yourself. And I talk about ascended masters and holy people and power animals and nature spirits. And then, so that kind of thing, to change something, you have to be willing to change. And you have to then be honest about it. Then I think, and this goes back to the New Age, a lot of people quote this, I don't know who said it, but they quote it, that you can't change something at the same level that it was created. So to me, what does that mean when I talk about this? That means you can think you understand it in your human thinking, but you need to go bigger. You need to go bigger to get more resources to help you shift. And those resources to me are spiritual, and they're from the unseen world. They can be plant spirits, nature spirits, energy of the trees, of the rocks, of the stars, your spiritual beings, your ascended masters, you name it, your power animals, anything that has a bigger frequency or vibratory pattern than you will only help you. And then you can help really make a shift.
Beautiful answer. And with that, let's listen to a message from one of our commercial sponsors here at UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. We're listening to Dr. Sharon Martin talk about integrating traditional and shamanic traditions. We'll be right back. So Dr. Sharon Martin, author of Maximize Your Healing Power, Shamanic Healing Techniques to Overcome Health Challenges. I love that you talk about willingness. Whenever I, as a medical intuitive healer, in my 30 years of experience in natural healing, when I have clients who've been to multiple practitioners, whether they are traditional or alternative, and they're still sick, one of the healings that I do with them is a healing to be willing to get well.
Mm-hmm.
And in one of my books called What is Healing, I talk about how there's 25 different payoffs for staying sick, fat, exhausted, and generally unwell, right? Mm-hmm. So these are secondary gains. And this is actually a pretty involved healing, because what I find is that we do get in our way, but when we're in our way, a lot of times we don't even see how we're in our way, on way, A, or B, what we can do to get out of it. So it's this inner resistance that we have to change, right? And just because someone comes to us and pays lots of money for a consultation doesn't actually mean they want to get well, which I'm sure you're well aware of. When you have clients with a lot of inner resistance, how do you help them overcome the inner resistance to get well?
That is it's hard, I'll admit that in the mainstream medicine model, to take the time to sit with somebody and work through a really deep healing practice you can't always do that. But to start and just say, are there ways that being like this has helped you? Oh, there's no way having back pain has helped me. Well, is that really true? Is there anything that you would lose if this were to go away? And then you start with for me, with my intuition saying, well, since you got back pain, your daughter's been doing all the housework. Has that been a good thing? Oh, it's so good to have her there. I never used to see enough of her. Now she's there all the time. So if you got over this back pain and you had to start doing your own housework, she might not be around anymore. But that takes some intuition on my part. Unless you have somebody who's really open to change and you say, okay, I want you to go home and I want you to journal. If this were to go away, what would change? And then when they come back, you could explore with them, well, maybe this wouldn't feel so good, would it? But sometimes people go, what do you mean I want to keep this back pain? I'm telling you, I'm in pain all the time. There are people who love the identity they get from naming their diagnoses. They have never felt special or important. And when they have 20 allergies to 20 things and 10 or 20 diagnoses, somehow they feel a little bit more special. And that's a hard one to break.
Yes. And in my work as a medical intuitive healer, I have entire lists of payoffs. So when I'm doing that healing with a person to be willing to get well, I'm identifying those payoffs and helping people understand what do you need to do to overcome that, right? It's a really big deal. Now,
well, I'm also trained as a hypnotherapist. And so if I had a client outside of mainstream medicine, I might use hypnotherapy to get to, let's really talk about these. And then another, on an extension of that, I'm trained in past life regression. So is there something in a soul contract that's kept you here? And even though it may not seem obvious in this lifetime, and I happen to believe in past lives, there's something there.
Yes. So I'll give some examples of some of these payoffs or secondary gains. As you mentioned, feeling special. Addiction to pain itself. You can be addicted to being in pain. Addicted to anxiety and depression. In other words, like that's your entire mindset. And even if you fix one thing, they'll find something else to be depressed about.
And you know what I think, Catherine? To me, there's a stable level that to many people feels boring. So when you're anxious or depressed, you actually get variations on this level. So you actually get feeling like you have juice in your life, even though it's got you anxious or depressed. But this feels too flat, like you have no value. There's no juice.
Another big one is doctor shopping. So I had a client recently who had headaches, and he brought in a list of like 30 different medicines that he had tried to help him, and a list of all the people that he'd been to. So doctor shopping. And so it's like, I'm so special, no one can help me get better, right?
Well, I think there's the thrill of presenting yourself to a new person and having them go, oh, when all of a sudden it's like, oh my gosh, let me hurry up and dig in and see what I can do to help. You get a lot of energetic gifts at that moment. And so I can see that you want to go find the next person who's going to flood you with their efforts, because I see that totally.
Yes. Another payoff is withdrawal from life. So people use their illness or their overweight or their fatigue to not participate in life. I don't have to put on a bathing suit. I don't have to go to the party. I don't have to have a life. I can just lie in bed and be miserable, right?
I don't have to be challenged or be uncomfortable and have to force myself to adapt.
Yes. Expectations of failure. So it's like, I can, as you said, I don't think I can overcome this. Whereas you and I both know that every illness known to man has been solved by somebody, right? And if you're determined and you use integrative healing, a lot of times you can be the lucky one to overcome that serious cancer, the trigeminal neuralgia, the back pain that you've had for 20 years, right?
And miracles do happen.
Yes. So what do you consider the future of medicine as someone who integrates allopathic and shamanistic traditions?
I don't know that the medical model, and I would wish for our relationship with insurance to change. I don't see that happening anytime soon. But what can happen right now is to bring in the realm of consciousness, of our beliefs, of our connection to the universal field, our eternal selves, and the power of our belief to shift our health. And if we could kind of push mainstream to incorporate that, it's coming. As fast as I'd like it, no, but that would be a huge addition and improvement.
So you've integrated allopathic and shamanistic traditions. And as you, I'm sure, are aware, one of the factors that helps people stay healthy is actually money, right? Especially in the United States. In the UK, we have the NHS, but even sometimes people are tired of waiting for a long time. In your view,
there was a recent study, was it in Oregon or California, where they gave, and I'm going to make a number up here because I don't remember, $750 a month to people for a year. And they thought, oh, these people are going to blow it on chips and cigarettes. And they got themselves an apartment. They started having food. They actually went to a job. They could fix their car. I mean, that might be what you're alluding to. That was a phenomenal experiment that they did. And the benefits, just by providing somebody with that financial assistance.
In your view, how has money ruined traditional medicine, traditional allopathic medicine?
It makes me I don't have the time I want because I'm pushed to move along. That's the main one. The other is, if a person can't afford it, their insurance will pay, but they have a $20 copay. I might not be able to order that important test to show a lung nodule and get them treatment for lung cancer. It's the way medicine is linked to money, to me, is terrible. I have no control over it. I just kind of try to do my workarounds.
Yes, my brother is an eye surgeon, and he's a wonderful doctor. I've seen him in action. He's so kind, so compassionate. And I remember one time having lunch with him. I believe he saw 50 patients in the morning. Okay. Whereas for me, my shortest session is an hour. So I'm really taking time to listen. I'm really taking time to explain. Now, with that, Dr. Sharon Martin, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. We'll be right back. My name is Catherine Carrigan, medical intuitive healer. We're listening to Dr. Sharon Martin, the author of Maximize Your Healing Power, Shamanic Healing Techniques to Overcome Health Challenges. Dr. Sharon Martin. I personally have studied natural healing all over the world. You have studied shamanic traditions with Alberto Villaldo, Jean Houston, Carl Greer at the Lilydale Assembly, the Casey Foundation, with Patrice Fields and CC Treadway and others. In studying shamanism, what are some of the most important things that you personally have learned?
For me, is now just share that as a growing up, my family dynamics were pretty rocky, very unsettled. So I had a lot of anxiety, a lot of suspicion. And the first thing that I can say that I gained from studying shamanism is knowing that I'm not alone. And that I have protectors in my ability to connect to the unseen world. And then the next thing, the sort of the finesse, that felt good enough. I could have stopped right there. But then the finesse is that I have helpers. And there is no situation that I can't get assistance with. And then I feel like I have tools. Face it, the world nowadays is a crazy place. And so I have tools to kind of navigate some of the craziness.
I love that. Now, you teach rituals. What does a ritual bring to the table of healing, and how does it impact us?
A ritual, if you're doing it right, is that sweet spot between you and spirit and your highest wish. A ritual, when done, you're totally present. Every bit of you is committed to the prayer you're doing, the intention you're doing, the action you desire. And when you enter that ritual, especially if it's a ritual done by thousands and millions before you, you are entering, and I'll just use my words. I don't know that this is actually true, but energetically it feels right. You are entering that energetic vortex of what all those people before you have done. Like if you were to be at a sacred site, you were to go to the Wailing Wall, you were to go to Chaco Canyon, Machu Picchu, Chichen Itza, any of those places. You're entering that sweet spot where you are fully present with spirit. And then the power is incredible. So when you sit in a ritual, you're putting all the distractions of the world aside. You are saying, here I am. If you talk to God, you say, here I am, God. I want this to happen as I light this candle. I want this, and I'm asking for you to join me in making this happen. That's a beautiful, sweet spot, I think.
In your professional opinion, how powerful is the ritual of prayer?
Huge. Even if you don't see prayer as needing to connect to God or to a saint, when you just sit in that wish, I call an intention kind of a laser focused arrow aiming at your desire. When you sit with that laser focus, heart, mind, body, soul, all aiming, that is huge.
What is the field of universal consciousness, and how is that playing a role in our healing?
What physics is starting to show is what many mystics, especially those from India, already knew, is that our reality is shared by our consciousness. And our consciousness is informed by this universal field that they call the universal information field. And that field holds the directions, I'll say, the templates, the instructions for how we live in this 3D reality. And it holds the instructions for how our bodies work. So connecting to that, you are joining the life force of creation.
So, Dr. Sharon Martin, many of our listeners are people who work in the field of natural healing. How can professionals in natural healing do a better job of working with traditional medical doctors?
It does seem like that's a big gap to cross, doesn't it? I think starting, if I were a doctor who didn't believe in this, if you came to me, it would go over easier. Now, I'll admit there's a lot of ego in mainstream medicine. Go over easier if you say, I think this would be a good adjunct. Let's do this together, not replace. There's a lot of ego and a lot of territorialism in many things, and mainstream medicine's big on that. But to say, let's share an approach, and then the feedback from the patient will probably help. A lot of patients are fearful to tell their doctors of what they're doing because they get laughed at or get told it's hooey.
So I have a great privilege. For the past 7 or 8 years, I work with a healing center in Costa Rica.
Mm-hmm.
And before anyone gets there, they fill out a form and send me a photograph of their face.
Mm-hmm.
And from there, I spend an hour, hour and a half writing a medical intuitive reading, which then goes to the folks in Costa Rica, so that when these people come there from all over the world, then the healers in Costa Rica know what's going on with that person and know how to help them get better. So I am part of a healing team.
I love that.
So how
we need more of that.
Yes. So how can those of us in natural healing be part of an effective healing team?
I'll start by saying I think the reason why there aren't teams like this, or if they are, they're rare, is insurance doesn't pay for them. So
Mhm.
most people cannot do it. They cannot afford to do it, which it's a whole nother discussion, and it's one that can make you get a little angry. But having that team approach, that would be a fabulous way to work for me anyway, to have that everybody's input with the sole purpose of shifting a person's health condition. That would be wonderful.
Well, before they hired me, the owner got 100 readings on himself from intuitives from all over the world, and they hired me because my readings were the most accurate. And I write out a report. It goes to the individual, the person, and then as well as to the people in Costa Rica. And I cover physical, energetic, emotional, mental, and spiritual, the environment they need, the nutrition they need, the supplements they need, supportive therapies and exercise. So it's really a blueprint for optimal health. So Dr. Sharon Martin.
And I'll bet some of being in a medically based family rubbed off on you.
Absolutely. I have respect for healers of all traditions, right?
But you also got that kind of rigor probably from a life with your dad and your grandfather and your brother.
Yeah,
that's a very good care plan.
Yes, I grew up. My father would make rounds at the hospital, so he would go visit his patients after operations. And as a little girl, I would go with him,
Mm-hmm.
and have a lot of compassion for anybody who has to be in the hospital. That's no fun. So when you think back to all the different teachers that you've had, who is the most profound teacher that you have had in all your studies? And what was the most profound message you received from that teacher?
The one who comes to mind first is Dr. Carl Greer, who is trained in Peruvian shamanism, but also studied other types of shamanism. He's a Jungian analyst, former CEO of a large corporation. And his ability to sense energy was what I learned a lot from him. But he was very good at making sure I handled the concept of reciprocity. So what does that mean? It's that balance and that give and take. So anytime you do an interaction, either with your client energetically or with a power animal, you don't just take and take and take and take. Even as simple with your client as having a dialogue. You ask, and then you wait and you hear the answer. And on most of my meditations or visualizations, when I have the client work with their higher self, the best thing you can do is ask and then listen to the answer you get. So that was really embodied for me with working with Carl.
So the concept of reciprocity, of receiving the information, and does that also include gratitude for the power animal or the spiritual?
Absolutely. So with dialogue comes, for me anyway, the closure of every dialogue is gratitude. And that mutual respect, as I say in my book, nothing sends a power animal packing quicker than you not acknowledging it. You can't take and take and take and think you're going to keep getting more.
Beautiful, beautiful. I love that, right?
I love that.
Yes, yes. So how can we incorporate gratitude into our healing practices so that it helps us be healthier?
I think if we could have everybody, whether they're in a medical situation or not, take a moment several times a day to have gratitude, even when you're certain that nothing's going right. There's got to be something you're grateful for, that you're still breathing, that your heart's still beating. That energy of gratitude softens the heart, opens you to the universal field, relaxes your resistance to everything around you, and truthfully adds to a better place.
I love that. When I have follow-up sessions with my clients, I have a practice for an initial second, but my follow-up sessions, I ask the client what's going well. Because one of the things we know is that whatever you focus on is what expands, right? So if I notice, wow, that thing you told me to do, and now, my neck pain is better, or my digestion is better, or my energy is better, and I notice what's better, and I feel grateful that I'm better, then we can continue that energy, right?
And I think a good extension of that is a reminder for all practitioners that you want to use your words for the good, to promote well-being, that what you say, even if you see something that's not right and something that could be life-threatening, as I see often, find something good to say to promote well-being, even if it's something like, I'll be with you every step of the way. That's critical.
I love that. Yeah. And I'm with you. I mean, even when I'm talking with clients with stage 4 cancer, I'm always talking about, what can we do to experience greater well-being, right? So what is that? How can we experience that joy, that peace?
Well, one of the sections in my book, it's not a big section, but what I learned a lot from Alberto, there is cured and there is healed.
Mm.
And you can still have cancer and feel healed.
Amen. I love that. I love that. And I was doing a medical intuitive reading with someone recently who had been sick for a long time. And I told her, I'm like, your chi is in the 80%. It's really hard to get any higher than that in the society that we live in. And it was almost like she was a little disappointed, like, okay, you're not sick anymore. Go out, go live your life. So Dr. Sharon Martin, you are a medical doctor who incorporates shamanism into your practice. How do you keep yourself healthy? What are your personal practices for health and well-being?
I could do better. I live in a very beautiful rural property. In fact, the lily pads you see behind me in the Zoom wallpaper is my pond in my front yard. For me, animals and connection to nature has restored me. The COVID years, which aren't really over, but the COVID years were horrible. And I was so grateful for the animals and the nature that I live in. So that's important. For me, it takes a little extra effort because, again, I live very rurally. So to go to a grocery store that stocks a lot of good stuff is an hour away. But trying my best to make sure I get plenty of plant-based options, green leafies, those things, those basics, being in nature, being grateful for my animals. I have 2 dogs, so that's always good. I have a horse, I have a miniature donkey, that lights up my life. Could I do better at exercise? Yes. Could I do better at not worrying so much? I worry about my patients all the time. I did something, Catherine, I did something new recently. It's been about 2 weeks. I used to get on Twitter all the time because I deeply, deeply care about the democracy in America and our voting rights. But I was finding myself being a little too righteous and a little too anxious. I stopped doing it, and I started doing a meditation taught by Yogananda, a Hindu mystic. And that has helped. And I think it's going to help going forward because the world is crazy.
It just proves that you, like the rest of us, are human.
Oh my.
Yes.
My job is very rewarding, and it's not easy.
Dr. Sharon Martin, author of Maximize Your Healing Power, Shamanic Healing Techniques to Overcome Health Challenges. Any final thoughts for our audience?
One of the things, if you buy the book, I hope you do, you can get it on Amazon or Inner Traditions or Barnes and Noble. If you take the order number and you go to my website and you find the page about the book, you can get a lot of freebies. I love that. And we are more than we know. And we have power that we haven't recognized or taken on. And so my message to the world is here, and with my book, here is something you can do because you have the power. So that's my message.
You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. Our guest today has been Dr. Sharon Martin. You can find out more about her and her wonderful work at drsharonmartin.com. And remember, you can integrate natural healing and allopathic medicine. Take the best of everybody. Listen to all smart people and come up with a plan that works for you. Thanks so much for listening, and we'll see you next time.